If we're going to avoid tragedies repeating themselves, then the NHS needs to be much better at learning from mistakes. This is particularly the case when you have a tragedy which involves someone, for example, dying, a baby dying in a maternity unit or becoming severely brain damaged. What you want is a system where because of medical error, a baby ends up being born brain damaged in Blackpool, those lessons are learnt by the NHS maternity units in Cornwall, and they're learnt quickly. And that doesn't really happen in the way that it should. It doesn't happen in our system, and it doesn't happen in very many systems globally, hospitals that are very good at learning. They have created a culture where staff are able to admit to mistakes without worrying that if they do, they'll lose their jobs. And that is a really difficult thing, because if someone makes a mistake, and particularly if there's been a tragedy involved, the easiest thing for the hospital to do is just to say, well, that doctor was a rotten apple, and we fired them. And that makes life easier for everyone, because the patient feels we've had justice, the doctor's lost his or her job, and the hospital can just go back to being everything they did before. But if it was a systemic problem, then of course that tragedy will repeat itself. It'll just be a different doctor or a different midwife or a different nurse next time round. And so we still haven't got over this problem that people worry that they will pay with their job for being too honest.